Welcome to the Coronavirus Weekly Brief. We're your hosts. I'm David Sterman.
And I'm Emily Schneider. Here are the headlines you need to know.
On Sunday, the United States passed 500,000 COVID-19 related deaths, according to a tally by NBC. While interviewed on CNN's State of the Union, Dr. Anthony Fauci said,
"It's nothing like we've ever been through in the last 102 years since the 1918 influenza pandemic. People decades from now are going to be talking about this as a terribly historic milestone, in the history of this country."
This comes after President Joe Biden spoke at Pfizer's manufacturing site in Kalamazoo, Michigan on Friday, noting that deaths due to COVID-19 would soon reach 500,000. In a few days, we'll cross 500,000 Americans who will have died from COVID-19, adding,
"That is almost 70,000 more than all the Americans who died in World War II over a 4-year period."
On Friday, hospitalizations due to COVID-19 dropped below 60,000 for the first time since November, according to the Atlantic's COVID tracking project. Analysis by the Financial Times noted this new low number is a drop of about 55% from the country's peak of over 132,000 in early January. The COVID tracking project also notes that the test positivity rate of the U.S. dropped to 4.8% as of Saturday, which is the lowest it has been since October 2020. January's test positivity rate was as high as 13.6% following the holidays. On Friday, Brown University School of Public Health Dean Ashish Jha promoted the idea of pushing back the dates of providing the second dose of the coronavirus shot in order to inoculate larger swaths of the population, though he still advocated for a second dose. However, Director of National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci, responded that a single dose may not be enough to build up a sufficient immune response in the body, particularly against recent virus variants. California, Texas, and New York continue to struggle and have the highest numbers of COVID-19 related hospitalizations. New York, California, and Florida have the highest 7-day rolling averages of new coronavirus cases across the U.S.
Researchers from universities and mental health research institutions in Belgium, the United Kingdom, Denmark, Italy, Spain, Turkey, Poland, France, and the Netherlands published a paper in The Lancet Psychiatry, noting that the European Union has not focused enough attention on vaccinating those with severe mental illness, such as psychotic disorders, bipolar disorders, and severe major depressive disorders. So they are also, quote, particularly at risk for severe COVID-19, unquote. Only 8 of 20 European countries explicitly mention psychiatry or mental illness in their national vaccine strategy documents, and only 4 countries, Denmark, Germany, the Netherlands, and the UK, have some sort of higher vaccination priority for outpatients with severe mental illness. According to a news release by the European College of Neuropsychopharmacology, those with a psychiatric disorder have a 65% higher risk of COVID-19 infection, and severely mentally ill patients are between 1.5 and 2 times more likely to die. The press release said that early vaccination is needed to protect those individuals from severe or even fatal COVID infection, and said that they need to be prioritized in the same way that at-risk patients with physical conditions are prioritized. Further, individuals with severe mental health disorders are more likely to have other pre-existing conditions, such as diabetes or cardiovascular disease, making them even more susceptible to severe COVID-19.
On Sunday, the British government said that every adult in the country can expect to get the first dose of coronavirus vaccine by July 31st. This is a month earlier than the government's previous target. Everyone over the age of 50 and everyone with an underlying health condition will get the first of 2 vaccine shots by April 15th, which is also a few weeks earlier than the previously stated goal date. UK Secretary of Health Matt Hancock said the government now has the supplies needed to speed up the vaccination campaign, following supply problems by pharmaceutical companies AstraZeneca and Pfizer, both of which are supplying vaccines to the UK. Britain is delaying giving people a second vaccine dose until 12 weeks after the first, rather than the 3 to 4 week recommended window. The approach has been criticized by some health officials and Pfizer, which says it does not have the data to support the longer interval. But the UK scientific advisors have approved the delay. They reason that it is better to have more people with at least some protection.
British Prime Minister Boris Johnson is planning to announce a roadmap out of the current national lockdown today in Parliament, but has stressed in the past that economic and social reopenings will be slow and cautious. Under the plan, English schools would reopen on March 8th. They have been open only to vulnerable pupils and to key workers' children since the beginning of January. Still, the news that vaccines will be administered more quickly than previously thought is welcome news to the country that has had more than 120,000 deaths, the highest toll in Europe.
Tensions are emerging between the Biden administration and some governors over the administration's proposed COVID response plans. Politico reports, quote, "The White House is locked in a delicate dance with governors over reopening schools, distributing COVID shots, and enforcing mask mandates, with Biden's team wary of alienating key state leaders, even as it takes stock of the lurching response to the crisis. Governors, in turn, are starting to push back on the first federal efforts to pressure them," end quote. A White House spokesperson said that our strong partnership with states over the last several weeks is helping us vaccinate more people, end quote.
To see our daily brief, go to the address in our show notes and follow us on Twitter @NewAmericaISP. The Coronavirus Weekly Brief was produced by Shannon Lynch and Jason Stewart and was edited by Shannon Lynch. The podcast is brought to you by New America and Arizona State University.